Hello, everyone. Welcome back to Fresh Dental Shadowing. We are really excited to have Dr. Brittany with us on today's session. Dr. Brittany, whenever you're ready, feel free to start your presentation.
Hello, thank you for having me, and thank you, Mahira, for reaching out to me. I'm really excited to talk to you guys today. Let me see if my screen's gonna work here. Okay, perfect. So my name is Dr. Brittany Bakura. I kind of keep my last name off of social media just for like privacy reasons, but I'm sharing it here with you guys today because I want you guys to be able to reach out to me and know I'm a real person. um, And so I consider myself a public health dentist. I work at a federally qualified health center. Um, Actually, public health is a recognized specialty by the American Dental Association, but I did not do a public health specialty. I'm kind of unofficially a public health dentist just because I am a general dentist that works in the public health sector for a nonprofit. So that's why I kind of use that term. A federally qualified health center is also known as a community clinic, and they're clinics that treat patients usually on like government assistance, like Medicaid, um, Medicare, any type of government funded medical care. I'm really excited to share this with you guys because I feel like public health is a really small niche in dentistry. A lot of people don't know about it, and I didn't know about it till my third year of dental school, and so I like to talk about it because it is an option to go into that you might not even know. And we definitely need more people to be in the public health sector of dentistry, especially with the state of our economy right now. So I'm excited to share more with you guys. Try not to click too many times. Okay, so what I want to talk with you, and I'm going to try and be respectful of your time because I know it's a weekend, but I want to touch on my journey to dental school because I know you guys are all mostly pre-dental or in college, and I want to, share information that's relevant to you. I don't want to go too much into dental school stuff when you guys aren't really there yet. I wanted to talk about why I chose public health dentistry and kind of what that field is. And then I want to kind of bring you virtually into my office to see what a day is like working there. And then at the end, I want to briefly touch on loan repayment and the cost of dental school because I think that's important, especially for you guys going in, deciding where you're going to go. It's important to know like what to consider and what to look into with that. Perfect. So I went to college at Occidental College in Los Angeles. It's a very small private school you maybe never heard of. I graduated in 2013. I was a biology major and a Latin American Studies minor. And so I want to give you guys some background about my journey to dental school because it kind of led me to what I do today. And so I think it is kind of important. I want to emphasize that everyone's journey to dental school is different and unique. And that's what makes our profession what it is today. I mean, if we all study the same things and we all have the same interests, we'd all be robots and dentistry wouldn't be as interesting as it is. And I love that we can all sit in a room with 5 dentists and have 5 different ways to do the same thing. So I went to college knowing that I wanted to be a dentist. I want to emphasize that that's not the norm. I knew when I was like 13, it's like really weird. So if you don't know, or you're still kind of trying to figure it out, I think that's important to know that's normal and not feel pressured to make a decision right this second. I'm almost 30 and I still sometimes think like, oh, what if I did something else? Not that I don't like what I do, but I think it's okay to kind of still try and explore. I think our 20s are for exploring. I knew I wanted to be a bio major, but it's totally okay not to be a bio major. And I know the other speakers also touched on this, so I won't go too much into that. When I was in college, Instagram had just started my junior year. And back then, Instagram wasn't what it is now. You guys have so many resources and ways to reach out to other students. I was the only pre-dental student at my college. I didn't know anybody. Instagram was used to like filter a photo so you could post it on Facebook. Like it wasn't a thing. So, which is crazy. I also want to touch on the fact that sometimes Instagram can be a highlight reel when we're following dental students and they're in their really cute scrubs and they're taking their model photos. I want to share like my real numbers with you guys so you have a reference of like what it really like a real person that went to dental school and like what my stats were so you guys have something to reference back to. I considered myself an underdog in college because I didn't have the highest grades. I was super involved, and my college advisor was not supportive and constantly told me like I was never going to make it. And so I didn't let that get me down. I still, applied and tried my best. And I think it's important to be well-rounded, and like how you do an OChem does not define you as a person. So hopefully, I know it's hard when we're in that bubble, but don't try to like get too caught up in that, because once you're out, you'll look back and think, oh my gosh, I stressed way too much over that. Okay. So my advice to you guys who are in college right now, like I said, grades are not the most important thing. Make sure you're happy and enjoying yourself and doing things you like to do. When you get involved in organizations, make sure that they're actually important to you. Don't just sign up to be president of like 20 clubs just because it looks good on a resume. I was on the admissions committee for my dental school, so I was interviewing dental students or I guess pre-dental students coming in. And it was always very obvious when they were in clubs that they didn't really care that much about, because you'd ask them like, oh, what made you do that? Or what's the purpose of your organization? And their answer was like, So it's on the flip side, it's very obvious when people are involved in things that they love and they have chosen because it's something that they enjoy. So set yourself up for success. What I mean by that is don't take 3 lab sciences in one semester. You're just gonna like burn yourself out. Don't take more than 2 lab sciences in one semester is my personal recommendation. Try to balance your classes out so that you are giving yourself the best chance to succeed, and be strategic. And when you take like your DAT, don't take your DAT in a semester that you have OChem and physics and biostatistics. You got a lot going on. So you want to make sure you're giving yourself the best chance to be able to do well. And then my last piece of advice would be, if you're going to apply to dental school, apply early. Apply that first month of June, ideally the first week of June. And then that way, because it's rolling admissions, you want to make sure that you have the best chance to get in. Don't take your DAT in like August and be like, oh, I applied, but my scores aren't in yet, because technically your scores aren't in until August, right? And then make sure you're following up with your applications, because I submitted a couple secondaries to 2 schools and they never got them. And so a couple months later, I was like, hey, did you guys get my applications? And they said, oh, no, we didn't, but we're actually done reviewing, so we didn't pick you. Those schools happen to be UCLA and UNLV. So I didn't get to even interview there because I didn't follow up. So those are just a few things that I could remember that I wanted to share. So I wanted to share my test grades and everything with you. I'm not going to go too much into it. I just want to let you guys know that I didn't have super amazing grades. I'm still a dentist. I'm still a really good dentist. This doesn't define me, and it's okay. So, I know it's hard to know. There's no like cookie cutter perfect way to get into dental school. We're all individuals. We all have our strengths and our weaknesses. I went to a school that didn't really give out A's because it was a private liberal arts school, and they didn't do that. So I got a C. I got 2 C's. I didn't retake the classes. It was fine. I did my DAT one time and I did okay. I didn't do like amazing. I didn't do awful. I did okay. So I wanted to just list some of the extracurriculars that I did do, just to give you guys some ideas. Maybe you were like, oh, that's interesting. Maybe I should try that too. The most time-consuming one was that I was recruited for a Division III softball. So I played softball for my college. That's kind of why I even went to my college. But that was a huge time-consuming activity. I signed up for a sorority my freshman year of college. I would say out of all the things that I did, that was like the least meaningful, just because I didn't make a ton of connections and I was so busy that I didn't really have time to give to the organization. So not that there's anything wrong with sororities. I just think if I did it over again, I would have used that time elsewhere. I was involved in Young and Healthy Pasadena, which is an organization that goes into first grade classrooms and teaches them about oral hygiene and nutrition. So I'd go in like once a month to the same first grade class and, be like, how do we brush our teeth? What's good to eat? That kind of thing. It was super fun. I loved it. I know right now with schools being kind of closed, it's not really something that's going on, but eventually, if you're in the LA area, I highly recommend that program. I also did the UCLA General Clinic Volunteer Program, which I think still exists. And basically it's an 80-hour program that rotates you throughout the dental school, and you get to see different aspects of it and It was really fun. I'm going to talk about global medical training on my next slide, but I founded that chapter at my college. I was also a resident advisor for 3 years. I loved being a resident advisor for a freshman dorm. It was basically being paid to babysit college students and make sure they don't die, but it was really fun. I would highly recommend that. They pay for your room and board. So, and then I had a few other jobs. I worked in the mailroom, basically just did my homework while getting paid, and then tutored some elementary school kids and obviously shadowed dental offices on the summer and breaks and everything. The most meaningful thing I did in college that I think leads up to, public health would be global medical training, which is a very, it's been around for a while. It's at a lot of universities and colleges. It's not to be confused with global medical brigades. That's another organization that's a very similar mission. But basically, it's a group of pre-dental, pre-medical students that go to different countries. In my case, I went to Nicaragua, and we set up a clinic for a week in different villages, churches, schools, and we provide services to the people there. The doctors that we work with are locals, so they were local Nicaraguan doctors and dentists. And so they know the language and they know the culture and everything. It's really fun. I will point out that I don't have my mask over my nose or my mouth, and that's really bad. So please don't do that. But these kids are really sweet and it was really fun. This trip itself was like life-changing for me. I knew if I went and I absolutely hated dentistry that it wouldn't be for me. And this is like the worst conditions you could possibly ever see. Like, it's a third world country. And it was the opposite. I absolutely loved it and I didn't even want to leave because I just was having the best time. This resulted in the organization asking me to start a chapter at my college and kind of recruit more people to go the following year. And so I did that. 10 of us from my school joined with the University of Texas, and I think there was 30 of us total. And we went to Nicaragua a second time and did the same thing. And it was really, really fun. So that was probably the one thing in college I did that led me to what I do now. And then softball was like the other thing I mentioned. I mentioned studying for the DAT. I would recommend a formal course. Like, I don't even know what there is out there anymore because I realized I took my DAT like 10 years ago. So I took a Kaplan course. I'm still actually Facebook friends with my Kaplan instructor. He was really cool. I'd recommend 6 to 8 weeks of studying, no less, no more. Research shows that that's the perfect amount of time to study for a large standardized test because after 8 weeks, you start to forget the stuff you studied on week 1, and less than 6 weeks is arguably not enough time. And then I would highly recommend taking the test before the application opens because, like I said, apply as soon as possible, have all your test scores in. That's going to be the best chance you have of getting in. Just to share, I applied to 20 dental schools. I got invited for interview to 3 of them, meaning I got rejected by 17 of them. That's okay. So that's just kind of the game. You got to apply to a lot to get in, and all that matters is you get into one, right? So my dream school was UCSF. I actually did get an interview invite for the first day they were interviewing, which is insane. And then I was notified like 5 months later that I was on the wait list, and I ended up getting accepted in May. I got an interview invite for UPenn in January, and they accepted me in February. So I didn't know I was going to dental school. I just was kind of holding out hope to go to UCSF. And then USC, I got an interview invite really late, but I'd already put the deposit down for UPenn, so I didn't end up going to that interview. So I ended up going to UCSF for dental school. I went into dental school thinking that I wanted to do private practice. I was very good friends with my dentist. I had shadowed him. I had worked for him as a dental assistant before college and in between the summers, between semesters. He had mentioned to me that there would potentially be a place for me to work once I graduated from dental school. So that was kind of on my mind, like, I'm going to get in, get out, go work. I didn't really have an interest in specializing. I liked everything, like absolutely loved everything, which is weird. But I loved dentures. I loved root canals. I like couldn't imagine doing the same thing. And so I just want to emphasize that that's okay, because you feel a lot of pressure in dental school to like go do other things, and then maybe go to Christmas dinner or something, and you got like Aunt Sally saying, well, orthodontists make the most money, so you should do that. And it's not about it's about what you actually enjoy, and not about how much money you make at the end of the day. So that is that. I want to go back to the fact that I also did mission trips in dental school, which also led me to what I do today. So I went on my first mission trip. It's a mission trip, but it's technically a service trip because it's not religious or anything. But my second year of dental school, I went with the group that goes at my school, and I was a dental assistant that year because only the third and fourth years could provide treatment. My third year of dental school, I went again. That year, I was the coordinator of the trip. So I did all the behind the scenes of planning everything, buying all the supplies and shipping them to Jamaica and all that stuff. And then we went in September and provided services. And then my fourth year, technically you're only supposed to go 2 years, but they were short and they needed to fill the spots. And so I was very lucky to get to go my fourth year of dental school. And if once you're in dental school, I highly recommend doing one of these trips because it's just a whole different vibe than being in clinic. You have faculty and you're supported and everything, but it's just a whole different atmosphere and it's more relaxed and like you're not trying to finish a requirement or something. You're just doing dentistry for fun. So this was something that made me realize how much I enjoy doing dentistry on like very extreme cases, like very like underrepresented organizations. So then, I don't know if this is every dental school, but most dental schools have some kind of partnership with like community clinics around in their area. So UCSF partners with about 10 or 11 different community clinics in the Bay Area and just Northern California. I wanted to work at the one that was in Sacramento because it was really close to my parents and I wanted to kind of go home and hang out with them and work and see my friends and that kind of thing. So basically the way externship worked at UCSF was you would go on 3 rotations, 3 weeks long each rotation throughout the year, and you would basically go to these clinics and be a dentist for them. Obviously they would tell the patients this is a student dentist, but the patients were almost always like, oh, no problem. You're working on the patients, you have a full day schedule, just like you were an employee there. And then the dental director of that location is kind of overseeing you, checking your work, making sure everything's going okay, helping you with difficult cases, training you, whatever. So it's really, really, really fun because in dental school, you might have 1 or 2 patients a day. And usually it's really stressful because you have one faculty to, 10 students and you're waiting in line and all these rules and blah, blah, blah. But when you're in a community clinic under the dental director, you've got a lot more one-on-one and it's just, the atmosphere is a lot more laid back. So you get to do a lot more dentistry in a short amount of time. But when I showed up my first rotation, I was blown away that this even existed. I was like, wait, you can go to a community clinic and be an employee and provide dentistry, show up, go home, and that's it. Like, I don't have to own this office. I don't have to worry about if the assistants are showing up. I'm literally just worrying about the dentistry. Not only that, but I'm doing dentistry that I really, really enjoy on the clientele that I really enjoy working on. And so this kind of opened my eyes to maybe this is the kind of dentistry I should be doing. Maybe private practice isn't for me. I don't know. Shortly after that first rotation, I went to go see my old boss, the one that I was planning on working for, and talking to him. And he had already hired an associate, and he was really only looking for part-time work after I graduated. And that wasn't really what I was looking for. I kind of wanted more like mentorship and guidance after dental school. And it didn't sound like that was going to work out at that office. And so I started to rethink, like, what do I want to do? Maybe a few days after that conversation, this NHSC program launched. And so it's called the Student Service Program. It was previously only offered to medical students. And this year, in 2016, when I was about to be a fourth year dental student, they decided to open it up to dental students. So they posted, they were like, by the way, if you're a dental student, you can also apply. You have to be a fourth year dental student to apply. And then you are committing 3 years of service to work in a community clinic full time. In return, they will pay you $120,000 you will still have a salary with the clinic that you work for, but it is a contract. You can't back out of it, and it is for 3 years. So, it's kind of interesting. Some people that doesn't seem that long. Some people that's way too long. So it just depends on the person. But I thought that sounded great, and I had just finished my rotation, and I really enjoyed it. So I was like, I'm going to apply. I applied, and I had a letter of rec from the dental director that I was working with at the community clinic, and a letter of rec from my dental school coach at UCSF, and I ended up getting chosen. So 175 people get it each year, and I don't know anybody else that applied that year who was in dental school. But after that, a lot of people from my school started applying, and everyone I've known who's applied for it has gotten it. So I don't know if it's because it's not that popular, or if it's because by the time you're a fourth year student, you already have your plan set and this doesn't appeal to you. I don't know. So once I knew I was going to go work for a community clinic, I started to think now, okay, am I ready to jump right into that? Or do I want to do more training and go do like an AEGD or a GPR? I decided to, I'm scared it's gonna go too many slides. Okay, there we go. I decided to apply to do a GPR because I noticed while I was on rotation at the community clinic, the patients that came in who needed like specialty services, like really hard extractions, really hard root canals, if the provider at that clinic didn't do them, those patients were shit out of luck. And they basically had to get the tooth extracted, or they had to go pay a lot of money at a private office to see an oral surgeon. And so I decided I wanted to go to a GPR or an AGD that was going to train me on these advanced services so that I could provide more services to the patients in the community clinics and not turn them away. And so I went to UNLV. That particular program, I placed implants. I think I placed like 10 implants. We did IV sedation certification. So I did 20 IV sedation cases where you like place the IV yourself, you give them the medication, you're supervised and everything. And then you do the dentistry on them while managing them and making sure that they are okay. And then they wake up and then you discharge them. We also did, I think, 20 hospital cases where we took special needs patients to the operating room and did dentistry on them with an anesthesiologist. And you just do as much dentistry as you can in like 4 hours. But okay, so this is where I practice in Sacramento. It's a FQHC called WellSpace Health. We have 7 dental office locations and 12 dentists. We also have 7 hygienists. I try to take pictures of our office. It's actually really large, but when I was trying to take pictures, there was too many patients, so all I could get was my operatory. So this is the operatory I work in every day. The office I work at has 2 dentists, me and 1 other. This is what our schedule looks like. So basically, I am in chair 1 and chair 2. The other dentist is in I'm in chair 1, treatment, chair 1, exam. The other dentist is treatment 2, exam 2, and then there's 2 hygienists. So basically the way that the schedule works, and this is true for most community clinics, is you have 2 columns. 1 is for treatment, 1 is for exams. You kind of bounce back and forth between the 2. It works out fine because you have an assistant in each room. And so while you're doing a filling in the other room, the other assistant's taking x-rays, and it usually just flows really smooth. I see maybe like 12 to 20 patients a day. I'm not paid on production, I'm just paid salaried. So if none of my patients show up, I get paid. If double the patients show up, I get paid the same amount. I like that structure better because I like to be able to recommend treatment that I think the patient needs. I don't like to feel like, oh, maybe they are borderline between a crown and a filling, but if I recommend a crown, then I'll get paid more. So I'm going to recommend a crown, kind of ethical ordeal that some people have to deal with in private practice. On the flip side of that, there is potential to make more in private practice. So there's pros and cons to each situation. So I want to show some clinical cases that I do. The reason I want to show these is because I get a lot of criticism and I hear a lot of criticism about community clinics out in the community. Basically that a lot of people have this stigma that they only do extractions. They don't really do a lot of advanced cases. They don't really, all they care about is, taking out everybody's teeth and making dentures. And so I want to share some cases that I got to do in the last couple years that maybe will remove that stigma for you guys if you hear it as well. So I don't typically take out wisdom teeth just because I don't really enjoy them. But this patient came in, she had just been released from jail, and she had this huge cavity, bombed out tooth, and she was in so much pain, and she begged me to take the tooth out. And in certain cases, I will help the patient out if I can. In hindsight, this was a really difficult case because the roots were curved and bulbous, and she was Native American, so her bone was very dense. So it took me about 2 hours. The tooth broke. I don't have a picture at the end, but the tooth broke and I had to cut it out with the, drill it out with the surgical handpiece. And so that was really cool. This case, if you look at it really briefly, you might not think anything of it. You're like, oh, she had some pretty interesting crowns and now she's got very similar crowns. But if you look closely, you can kind of see this tooth up here is maybe detached from this crown. You can see cavities down here. You can see kind of cavity shadowing through there. So this case actually was 3 months long. And what I did was I did 1, 2, 3 root canals. The specialist did 2 root canals. I had to take this tooth out. So to take this tooth out, I had to cut off this whole crown bridge thing and extract it and then make her a temporary crown to go over the top so she had teeth. I did a bunch of fillings, obviously. And then at the very end, I did a 6-unit. These are all individual crowns. So crown, 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 and then a bridge. So it's actually pretty involved. And what's really cool and why I love what I do is this patient didn't pay anything out of pocket for any of this because it was all covered by Medi-Cal. So that's another reason why I love working in community clinic, because I can do all these services for these patients who really need it, who can't afford it, and completely transform their life. This is another patient where, and it's bleeding. I don't like to take post-op pictures the same day because their gums are usually puffy from the temporary crown, but I didn't get a chance to take one a different day. So that's why it looks a little gnarly, but she had these really ugly crowns. I don't know where she got them. And she also had cavities in here. So we had to do root canals, and then we did 4 crowns for her, and they look so much better in my opinion. But and again, she didn't pay for any of those services. This patient, she came in, I think it was a few days before Christmas. She had broken her tooth off and it was not savable, and we needed to take an impression to make her like a flipper to wear. And she was like, can you please do something about this? Because it's Christmas. The flipper wasn't going to be back till after Christmas. And so I stuck a post in the tooth and I freehanded with composite. I built up a tooth. It took me like a pretty long time. And then she was so stoked that she could go to Christmas with a tooth. She didn't want to look like that going to all the things she was going to. This was a couple years ago, so not COVID or anything. So that's, I really like being able to do that for patients as well, because especially for her, she had no other options. And this was an interesting situation where this guy only had 6 teeth. He didn't have any upper teeth whatsoever. Most dentists would just kind of take all of them out. I don't like to do that because lower dentures just don't stay. And if they have canines, usually a partial will clip onto a canine better. And so I try to save at least 2 teeth when I'm working on someone who's got the lower stuff going on with the lower. But in his situation, I was like, let's just crown all 6 of them. It'll be fine. I crowned all 6 of them. Like I said, I don't like to take post-op pictures when I cement them because they're usually bleeding. A week later, I brought him back in. I was going to take my after pictures. I was so excited. And somehow he broke his tooth, and I don't even know how, because he didn't have any upper teeth, so he couldn't eat. So I don't know what he was doing, but he was messing with them and broke his tooth off. Once that happens, it's kind of a domino effect. These other lateral and central incisors don't do well in my experience. So I ended up having to extract those 3. So these are the teeth I took out. I did like brand new crowns, and then I had to take the teeth out. So it happens sometimes. Like, you can't predict Um, but we ended up making him a partial on those 2 canines with an upper complete denture, and it looked amazing. And I wish I could show you guys. I didn't take a picture. And then this is a situation. So if you look quickly, you're like, ooh, these fillings don't match. So this patient was special needs, and she had nowhere else to go but our office, and she only liked female providers, and she only liked one of my assistants for some reason. She had an attention span of about 15 minutes, and so I think it took me 3 appointments to do all these because I had about 15 minutes of working time. She wouldn't let me get her numb, just super difficult patient. And so because we were working so fast, we didn't shade match well, unfortunately. But in that situation, it's either, we're not gonna be able to redo them because she's not gonna let us. The parents of the patient were completely happy with the results. They were just happy that she didn't have cavities anymore. And at the end of the day, like, that's the most important thing. And maybe they aren't like the smoothest or the shiniest or the prettiest, but we did the job, and that was all we could do. So, and she was really sweet. Those were her only cavities, weirdly enough. She just didn't brush that area, and she wouldn't let her parents brush it either. So, and then people kind of forget about scaling and root planing and deep cleanings, but deep cleanings are very rewarding. Like, I love cleaning people's teeth and removing staining and kind of giving them a whole new smile. So even though this is really simple, like, I just cleaned his teeth, I made a huge impact. And I mean, it's probably going to get like that eventually again because this patient drinks a lot of coffee, but still, it just makes the patient happy, and it's just, going above and beyond to make a difference in their day. That's why I like working in community clinics. And then I think this is my last picture, but so sometimes you take out a baby tooth, and depending on the situation, if the tooth has like amalgam in it or something, and you can't give the tooth to the patient, the little kids get really upset. And so I started giving them letters to the tooth fairy to basically write to the tooth fairy, hey, we're going to mail you this tooth. That way the kid's like, oh, okay, good, I'm going to get my money. Because a lot of times they're hysterical, like crying. They're like, you're not giving me my tooth. I can't put it under the pillow. So just, if that ever happens to you, you can always write the tooth fairy a letter and give it to the patient. And then they're usually pretty happy. Okay, I just want to briefly touch on the cost of dental school because it will affect the trajectory of your life. And it's just kind of something a lot of people don't want to talk about because it's kind of taboo and it's kind of depressing. I know a lot of the schools are getting more and more expensive every single year, and it doesn't seem to be slowing down. So just be aware when you are applying and when you're deciding where you're going to go. Have a plan if you can. Try and think of what you're going to do with that debt and what that's going to mean for you. Be open-minded to all possibilities. Be open-minded to loan repayment if that means doing a program like I'm doing. It's only 3 years. It's a significant amount. The NHSC scholarship you would apply for before dental school, that pays for the entire schooling. So it's technically a better deal, I guess, if you look at it that way. But I don't know about military. I'm not familiar with that kind of loan repayment, but like, another option to look into if that's something that fits your lifestyle. If it's not, don't pressure yourself into something just for the money. But just think about your options, and if you're picking between 2 schools, honestly, I feel that most schools are equal. I mean, they're going to tell you they're the best school, but at the end of the day, they're not the ones paying your bills. So just keep that in mind. I have an Instagram where I kind of talk about student loans, and it's kind of like a diary for me. I don't do it for like making money or anything. It's just fun. And I share like my journey. I'm actually hoping to pay my loans off this year in September or August. And so I kind of share like my daily, whatever I'm thinking on that day. And so if you want to follow along, I recommend it. No pressure or anything. I don't know too many other dental students that post about like the finances aspect of it. And a lot of the dental student profiles have reached out to me and been like, wow, I really like that you talk about this. I want to start talking about it too. And so hopefully it starts to become more of a thing that we all collectively talk about. And then just some recommendations, like very beginner, I would totally look into White Coat Investor. He has a Facebook group, he has a book, he has a podcast, he has a blog, he has a website. So any of those things, I would highly recommend the Facebook group and the book, I think the most, because the podcast can be a little dense if you're not really doing the things he's talking about. So it could be a little over your head. Some of it's over my head because I'm like not investing right now and stuff like that. Simple Path to Wealth is a really good intro book to just set up your mind for what you're going to do once you're working. It's good for anybody, not just like pre-med, pre-dental. And then I would say this is more of like an advanced, if you get into it and you're like, wow, I'm really motivated. Choose FI is a really good podcast to talk about the specifics of like investing and the FIRE movement. I don't know if you guys are familiar with financial independence, retire early, the whole thing that's kind of evolved in the last, I don't know, 5-10 years. So I would recommend if you start to get into it and you're like, wow, this is really interesting, that's the next step I would take. For me, what's next? So I actually am applying for my master's in public health right now. It's an online program, so I would be working and then come home and do school on the weekends and stuff like that. Because like I said, I'm not a public health specialist, but I want to remain in this sector and I love this whole area of dentistry. And so that's kind of a requirement to advance in this career. And I'm just so interested in it that I want to do it. I'm an associate dental director right now for my clinic, but I do eventually want to be a dental director. I'm developing an externship program for dental students like the one I was in because it made such an impact on me. I want to mentor dental students and like be able to have that same impact on them. And so my hope is maybe by next year, I will be able to bring 1 to 2 dental students in at a time to work like alongside me at my clinic. And they would see patients all day and I would help them, mentor them, whatever they want to do. So stay tuned for that. I'm hoping to pilot it maybe with UCSF first, and then eventually maybe open it up to other dental schools, maybe by the time you guys are in school. And thank you for listening to me for a very long time. I don't know how long that was. And I'm going to let you guys take over.
Thank you so much, Dr. Brittany. You did such an amazing job, and we really do appreciate it because I feel like you gave a lot of unique perspective on topics. Like I didn't even know what a community clinic was or a public health specialist. That's really, really cool. So we do have some questions from our Instagram and then also our YouTube Live, which we'll ask now. Okay, so do you think you should make a financial plan before deciding on which dental school to go to?
I think it's hard to until you know what you're working with, but I think comparing and contrasting schools that you did get accepted to, I think you should do that. And then once you do decide where you're going, then you can start to kind of finalize details of what you think that's going to look like. But I didn't go into this, but a lot of that, a lot of what I recommend as far as like student loan debt is trying to minimize the debt you take and not taking out the maximum loans every year if you don't need them, because a lot of the schools push you guys to take out all 100,000 or whatever. But if you can live on less, which a lot of us can, then you can actually minimize the debt you take out, which in the long run helps you with your financial plan.
Thank you. So someone asked about the scholarship. So the 3-year contract, does it start after you graduate dental school or after residency, or is it up to you when you want to do it?
Yeah, it's up to you. They let you do either a 1-year GPR AGD residency or a 2-year pediatric residency. So it would start, I think they give you 6 months after you finish residency to find a job, and then it would start right after.
Wow. And can you apply twice and then commit 6 years, or is it just once?
You apply once and then you can renew the contract 1 year at a time after that. I think the maximum you can do would be 5 years until they make you reapply through the loan repayment program, which is like a separate program. It's called the loan repayment program. So NHSC has 3 programs. The first is the scholarship for when you're not in school yet. The second is student service, which is when you're a 4th year. And the third is the loan repayment program. And so you would basically bounce between the student service to the loan repayment program.
Okay, thank you. Someone asked, what other work can you do with an MPH in dentistry that is different from what you're currently doing in practice?
You know, I am still kind of figuring that out because I just kind of found out about it in the last 6 months. You'll see a lot of MPH DDS doing research. That's actually the most common. But I've noticed a lot of them are in like public health positions, like with the county or the like federal level. And so I'm still kind of figuring out what else there is out there. But right now my focus is doing like on the clinic level, and maybe one day I'll do more.
Right. So have you had any cases that needed to be referred out to a specialist? And if so, what would be the process and like how would they cover it?
Yeah. So in California, you have to remember that we are unique in that we pay a lot of taxes and our social services are really good. So the Medi-Cal, which is Medicaid for Californians, covers so many specialty services for dental. So they can go see a root canal specialist, they can go see an oral surgeon. I think pretty much any specialist except obviously not ortho unless it's medically necessary, which is hard to prove, and obviously not like a perio surgery type situation. You're not going to get implants. But basically what happens is you submit something to the insurance and say, hey, this patient needs this. Here's the x-ray. They approve it. They send a letter to the patient and say, hey, you got approved. Here's the location you're going to go to. And then they go to that location and that doctor takes care of it. And then they send them back to you. So it's really easy. The only difference between that in my county is that my county is piloting a program where they are contracting the specialists. In other counties in California, they're basically just a free-for-all. So they make the patient find their own specialist, which is very difficult. And so that's why they're trying to kind of roll out a more smooth system. In other states, there may not even be coverage for those procedures. So in that situation, they usually have to pay out of pocket, or the extraction might be covered, but like the root canal is not covered. So it kind of leads them to picking whatever's the cheapest option.
Yeah, makes sense. So we know you were on the kind of the admissions council and you interviewed a lot of students. Do you have any tips for us or how to go about kind of practicing for the interview?
Yeah, I think the best practice is just doing it, like practicing talking. I'm not really a good public speaker, and so I get really nervous when I'm interviewed myself. And I had a lot of students who were also very nervous, and so I tried to make them comfortable, and they usually came out of their shell. But you don't always get that. Sometimes you get really scary interviewers who are like not smiling and like don't seem nice, and it makes you more nervous. So I think the more practice just talking, even if it's to like your sibling, your parents, boyfriend, girlfriend, whatever, I think that makes it a little bit more smooth. And then what I would do when I was practicing was think of an answer to any question they might ask me. That way I have like a topic on the top of my head that I can reference. It's kind of nerve-wracking when they ask you a question and you're like, and you can't think of like an example. And then you're like, oh, if that does happen though, you just kind of say, oh, give me a minute, and then recompose and share. And I had students that did that to me, and they're like, can I have a minute? And I'm like, yeah. And I completely forgot that they even took a minute because they were so composed. So
yeah. So going from dental school into the real world, how different was that? And then how did your residency kind of help, and was it beneficial?
I think residency was helpful because it's almost like a false sense of security, because you have faculty, you're working at a university, but you are the dentist and you are the licensed individual. So it's kind of like you don't feel responsible, like you don't feel the pressure. but you're doing the work and you are doing it. So that way, when you go to work your first job, you kind of feel like, well, I've been doing this for a year. It's really no different. It's not, but it's just like the mental aspect of it. But I think for me, there's no right or wrong doing it in a residency or not doing residency. I'm glad I did one because I feel like in cases where, so my best friend, that my coworker, she is also an NHSC recipient, and she went straight to work at my clinic, and I went to residency and then worked at my clinic. So she graduated dental school 2018. I graduated residency 2018. So literally side by side, two individuals. There's cases where I have no problem doing the extraction. I'm not as scared to try it. And she might be a little bit more nervous. Ooh, I haven't done that before. I don't know. And so it's not that that's right or wrong. It's just like a kind of a comfort level that you gain in residency that you might or might not gain for a little bit longer while you're practicing.
Right. Okay, so the next question is about for someone who doesn't really know how to take out loans, how do you go about doing that? And then also your perspective on interest with loans. I know you put a post out recently, which I saw, but I don't think a lot of other people did.
So the loan process is super easy, and the school does that all for you. So you don't even have to worry unless you are not a US citizen. I believe that process is different, and I'm not familiar with how that works. But the school basically sends you like sign here, and then all of a sudden the money appears in your account, and then you pay tuition with, yeah. So that's pretty simple. My perspective on interest, right now it's super low, so that's good for you guys. But what I would recommend and what they recommended to me was do your best to take out the least amount of Grad Plus loans, because those are the loans that have the higher interest. And the federal Stafford loans, most of your loans will be made up of those, and those are lower interest. So they want you to max out the lowest interest loans first before you tap into the higher interest loans. Some people just are going to have to because the cost is going to exceed that amount. I was fortunate that I received like a grant from the school, basically like a scholarship. And then I had like parental help to pay my rent. And so I never had to take out Grad Plus loans. And then if you can avoid those, that's ideal. The admissions counselors will tell you to take out the maximum. If you don't need it, just give it back to us and it's fine. I don't recommend that because for me, at least, if I have money in my account, I'm more prone to spend it. And it's kind of harder to give it back than it would be. Like you can ask for more and it's super easy. I did that multiple times where I'm like really trying to live on as minimal as possible. And maybe I ran out of money at the end of the semester. I fill out an easy form, and then in a few days, more money appears in my account. Yeah. So it was kind of like taking out additional loans through the same program. I recommend doing that because then that way you're only really spending what you need. And if you do it the opposite way, you're more prone to spend what you don't need. Does that make sense?
Yeah. Yes, thank you so much. So I think you mentioned this a little earlier, but is it worth it to go to a more expensive school for the prestige? And would it maybe be easier to find a job if you did go to a prestigious school or no?
That's a controversial topic. I personally don't feel like one school is better than the other. I've never had a patient ask me where I went to school. I've never, even when I've interviewed, the only reason the school matters, I think, is they tend to like to hire associates that went to their school because you kind of have similar philosophies, but not because like their school is better or worse. Right. I think it just tends to foster like a better working environment when you guys were taught by the same professors and that kind of thing. So I would recommend, it kind of depends to like how you feel personally. My mentor in dental school went to Harvard, and she's very, very intelligent, and like it shows maybe because Harvard has a really strong D1, D2 curriculum, but does that mean she's a better dentist? I mean, you could argue that we're all great dentist, and it took her like 13 years to pay off her loans. That's a long time. So it just kind of depends on what's important to you. But I think overall, in my opinion, all the dental schools are pretty much the same. And you're really going to get that like main experience on your own, like doing mission trips, going to residency, going on these externships, that kind of thing.
Okay, thank you. So how do you apply to dental scholarships, or what are some popular ones? And is it common for dental schools to give out scholarships to their students?
That's a good question. So my dental school, I got a scholarship. I didn't apply for it, and I don't know how they decide. Like, I've talked to other students in my class that also got them, and so I'm not really sure how they give them out. But usually they'll tell you, like, in your admissions package or in your financial aid package, it'll just kind of show up there. And so I would look into, when you're applying, I would definitely ask that question to the financial aid person that comes to talk to you during your interview. And if they do have scholarships that you need to apply for, they'll let you know, oh yeah, we have this, it's available to the first 5 people that apply. You can do that kind of thing. I don't know any outside scholarships other than the NHSC and the military. So those you would apply for pretty early on if that's something you're interested in.
Okay. So someone asked, I know it varies by dental school, but at UCSF, what year did you start treating and working on patients? Just curious.
Yeah, and I think, I'm not sure about the other schools, but our school started in your 3rd year. So you had 2 years in 2 years doing like sim lab and like bio courses, and then 2 years doing like just clinical work.
And how hard was the transition?
I didn't think it was too bad because they kind of slowly like let you, I don't know what the word is, they like let you in slowly. So you'll finish in June, or at UCSF, you finish in June with your quarter, and now you're officially a 3rd year. You enter the 3rd year, that summer quarter, and it's usually like a lighter load. And so you're taking over cases that the other students left behind, and then you're starting over with new cases. And they all know you're new because it's like a new quarter. So all the faculty are super supportive and helpful. And then as the year goes on, they get more hands off. So it's kind of a slow transition. I don't think anybody felt like they weren't ready for it.
Makes sense. Thank you. So has the pandemic had a huge impact on your work, and has there been any major changes put in place because of it?
Really the only change was that we were not seeing patients between March and however long that went on, depending on what area you were in. Some people didn't see patients for like 4 months. And so depending on if you were in private practice or not, you weren't getting paid, which is pretty crazy if you think about it. But my clinic, because it's a community clinic, it stayed open. So we were still doing like teledental when we couldn't see them in person. Now that we're kind of, I don't want to say back to normal, but now that we're back into seeing like full-fledged patients, teledental is still a part of our practice flow, which is interesting because it never would have been before. And then other than that, the PPE is more like advanced, where we're wearing N95 masks and a face shield.
Right.
I have my hair in like a hairnet now. I didn't ever used to do that. They're just more regulatory of like how careful you are with how many gloves, make sure you're not taking your gloves off unnecessarily and that kind of thing. Other than that, though, I feel like, and we don't have extra people like in the waiting room, or parents aren't bringing like 5 kids in the back, that kind of thing.
Right. Thank you. So you mentioned your statistics and the grade you got for some of your classes that kind of may some people may relate to. So would you recommend retaking classes to boost your undergrad GPA, or just doing better in other classes?
That's a good question, and it could really go either way. You kind of have to get to a point where you are all in, like you're going to apply with what you have, or you're going to work on it and not apply and like retake and get to a point you want to be at. I wouldn't recommend being like in between where you're applying with what you have, but you're still kind of in the background trying to retake courses, because that can kind of get confusing. I would say, depending on how, I guess, you did in the class, a C, I guess you could retake if you want, if it's feasible for you. But I don't really know anybody that retook classes personally, so I don't know. I do know people that, you know, did post-bac programs and really liked that. So that's another option.
Makes sense. Thank you. So going with your undergraduate experience, do you have any research experience or internships that you did, and did that help?
I did participate in a research program. It was a summer research program that I applied to with the faculty on campus, and then it kind of overflowed into the junior year. And I think that looks, I think they like that. I think it looks good on a resume. I know I mentioned, you know, don't get involved in things that you don't have that much interest in. I, in the beginning, wasn't super interested in it. And by the end of it, I really liked it. So sometimes you don't know you like it till you try it. I didn't talk about that in there because it didn't really, I didn't end up doing research in dental school. So I didn't feel like it shaped me or anything, but it was really an interesting thing to be a part of. And I do think that they value that when you're applying.
Right. Okay, I think we have time for one more question. So how do you stay up to date with the new and innovative techniques in dentistry? Do you have to take, I guess, classes or more training after dental school or your job?
That's tough because I feel like I haven't been out that long where that much has changed yet. But I think the best way that I see older dentists do it is they stay super involved with the dental schools, or they volunteer, or they are really involved in the dental societies. And then that way they are getting that information, because if you kind of stay in your bubble, you can not get updates on a lot of things. A perfect example of that would be the American Heart Association changing the guidelines for pre-medication before a dental procedure in 2015. I was still in school, so I don't know any different, but I've worked for some doctors that didn't know it changed. And so just making sure that you're talking to other faculty or kind of maintaining some kind of relationship with the school, so you're getting that information. And that's kind of why I like working in community clinics, and why I want to bring on dental students into our clinic, is because I want to know what they're learning so that I can also learn it.
Right. Was it hard to get used to the tools and machinery in your community clinic coming from residency?
It really wasn't much different that I can think of. They're pretty like, they'll let you order pretty much whatever instruments that you want or that you need. So I haven't met anybody who felt like they were handicapped by what they were able to use.
Right, makes sense. Thank you so much, Dr. Brittany. Those are all the questions we have. We really appreciate it. And thank you so much. So, yeah.
Oh, and then I wanted to give you guys my email and my Instagram if you guys ever want to email me about anything, anytime. I'm willing to answer questions. And if you want to add me, message me on Instagram, then feel free.
Thank you so much.